Callie Hayes, and I am one of our occupational therapists here at the University of Utah Burn Center. Today I'm going to be showing you some quick tips and tricks for how to stretch your leg in the event that you have a burn injury. Your wound may be at any varying state of healing, but the principles and tips still apply regardless of the status of your injury. I'm going to start by showing you some things with the ankle. You can do these on your own, or you can have one of your family members or loved ones assist you in performing these stretches. So first stretch is having the patient point their foot towards you, or we call this a ballerina pose. You can apply pressure to the top of the foot to add a little extra pressure to that stretch if they are having a hard time doing it on their own. With this stretch, you don't want to necessarily apply pressure at the toes, but rather at the top of the foot so that you are stretching at the ankle. Then you're going to stretch in the opposite direction. This stretch is really important because this gets really tight for people if they are not getting up and moving around as much as they normally do. How this stretch works is you have the patient point their toes towards themselves as much as possible. You can then take one hand and support at the heel while taking your other hand and applying pressure at the ball of the foot and pushing it towards the patient. With all of these stretches and exercises, you want to hold that stretch for at least 20 to 30 seconds because that's how long it takes for skin to adequately stretch. Then you will come back to this direction. Another good exercise for the ankle is doing ankle circles in both directions. I generally have patients do 10 one direction, 10 the other direction. And then you can also have them spell the alphabet using their foot, which allows the ankle to move in every plane of motion. If you are needing help doing the stretch and you don't have anyone else around you, you can take a sheet or a towel and around the ball of your foot, not your toes, wrap the towel or sheet, and then pull on your foot so that your ankle is stretching. And again, hold that stretch for 20 to 30 seconds. The ankle pumps, as we sometimes call them, or moving your foot like you're pressing a gas pedal, is also a really effective way to get rid of some swelling or edema in your foot and leg if you have that. You can be laying around or on the couch and just constantly doing these to kind of also help with your swelling. But you need to do the prolonged 20 to 30 second stretch in these areas if your burn does cross your ankle joint. Next, let's talk about your knee. If you have sustained a burn injury to the back side of your leg, it is very important that you work on straightening your leg and making sure that you keep your knee completely straight. How doing this stretch might work is that you might support the lower leg or at the calf and apply pressure to the top of the knee joint to ensure that the knee is getting completely straight. You can also do this by applying pressure over the knee and doing that combined ankle stretch at the ball of the foot, like so. If you are working on stretching the knee, you can work on helping bring that knee up to your chest. How that might work is I support the patient at the heel and at their calf, or maybe directly underneath that knee joint, and slowly bringing the knee up as high as the patient can tolerate or until they feel a stretch. Again, holding it for 20 to 30 seconds. This stretch is also working on stretching the hip if they are having tightness in that area as well. And then slowly bringing the leg back down. Some additional leg exercises that you can do when you are laying down is bringing your legs together, like so, and then bringing them apart. You can support your loved one by holding them underneath their heels or at their calves to bring the legs together and apart. You can do this exercise one leg at a time also if they're needing more support, out to the side and so forth. Those are some basic exercises that you can do if you have sustained a burn injury to your leg. It is also very important that you are getting up and walking around your space, likely your home, and if that means you have to walk around a lot, that's better than just laying around. I recommend performing these exercises a minimum of 3 to 4 times a day, but the more you do, the better outcome you will have in the long run. If you have sustained an injury to your legs and or feet, we might recommend that you limit the amount of time that you are standing or walking initially to possibly 20 to 30 minutes to help manage with severe swelling if you have that. Your therapist here will be giving you specific instructions on what exercises you need to perform and ones that you maybe don't need to perform. And if you have any other questions regarding your therapy needs, please feel free to give our office a call. Our phone number is 801-581-2132.